Hi there, Dr. Kerry Yerkew here, and today I'm going to go over shoulder stretches. If you're trying to heal from rotator cuff, which is a shoulder impingement where the tendon gets pinched between the ball and the socket, maybe adhesive capsulitis like a frozen shoulder, maybe a shoulder injury where you fall in an outstretched arm, these stretches are very good in combination with chiropractic care to realign the joint and to improve the joint function and stability. So some of these stretches are combination type of stretches where you're stretching the shoulder but you're getting the rest of the body involved, and I kind of like that because it makes you work the accessory muscles, the muscles that will help the shoulder to function properly. So this is one of my favorites, cow face clasp hands. Put your arms behind your back, arch your back, chest up, and that's going to stretch out the front part of the shoulder where the biceps tendon and the supraspinatus tendon insert. This is a little bit better for the biceps tendon, but it's very good to hold that for 3 to 5 seconds and do this about 5 times to start, first thing in the morning and then just before bed. I like the lunge with the arm extended up. So as long as you're in good shape in the lower part of your body, you can do this lunge and then twist your body, stretching up. This is good for the rotation of the upper thoracic area up here, and then the rhomboid muscles and the rotator cuff. And just hold that 3 to 5 seconds and then do that about 8 to 10 times on each side, first thing in the morning and just before bed. I do like the crescent lunge with the knee on the knee with the cactus arms. That's a tongue twister. So crescent lunge on the knee with cactus arms. You're going to go into this lunge position, but the knees down on the ground, and then you're going to arch your back and then reach up towards the ceiling with the arms overstretched. You really want to get a stretch in the under part of the arm right here, as well as the rotator cuff muscles right here, and the pectoral muscles that attach onto the front part of the shoulder. I do like this one right here, standing forward bend with shoulder opener. This one's good because you have to bend forward, balance yourself, and then arch backwards with the arms, extending them back. Now just be careful if you're pinching any of the tendons or the nerves in the shoulder, then you just want to be conscious of that, back off, and don't go into a sharp pain position. So if you have some pulling, stiffness, stretching, that's okay, but if it starts to get sharp pain, difficult to do, then consult with your health professional before you go any further. And then cow face forward bend. I do like this one with the legs crossed and the back straight, and then trying to touch the shoulder blades or reach back so both hands touch each other. One goes behind the back, that's the right one here, going behind the back. The left one's going over top of the head and behind the back. You're trying to touch both hands together. Now, you might only be able to go so far with this one to start, but as your shoulder starts to get better with range of motion, in combination of chiropractic care, and then you start to do these stretches, you should be able to increase your range of motion and get closer and closer for the hands to go together. Of course, everybody's different. So some people have had previous injuries, they're not able to do that. And some people have injuries and scar tissue, so they can't do that. Something I like to do in the clinic is using shockwave and laser for old injuries or scar tissue, because it does help to break down that scar tissue. So it's definitely something that you could look into. But for today, these stretches and exercises are very good in conjunction with chiropractic care to improve the range of motion, the alignment of the ball and socket, and restore the function of the tissues in between the bones. Please subscribe to this channel, like this video. We're getting closer and closer to 1,000 subscribers now. So please follow this channel if you like these exercises, and please leave a comment or a DM if you have any questions.